Madam Chair, Ranking Member Foley, members of the Health and Human Services Subcommittee, thank you for allowing me the opportunity to be here this afternoon to testify before you on House Bill 59. My name is Blaine Brockman. I'm testifying as the President of the Ohio Association of County Boards Serving People with Developmental Disabilities. We're a trade association that has represented 88 Ohio County boards since our founding in 1984. I've been a member of the Madison County Board of DD for 11 years. During that time, I've witnessed firsthand many of our system's great accomplishments. I've witnessed this because I have a sister-in-law, Rebecca. She's a person with developmental disability. Rebecca lives a pretty good life, actually. She lives independently in London, Ohio. She works, she goes to church, she pays taxes, she pays her rent, she votes most of the time. All of which make her a contributing member of our community. But this doesn't happen by accident. It requires the community to support her in return. As a family member of a person with developmental disabilities, I am proud to do my part to help Rebecca and others like her succeed. I'm like every other board member in the state. Each of us is a volunteer who lives in the community we serve. 3 of the 7 members of a county board are required to be immediate family members of a person with a developmental disability. County commissioners, probate judges appoint all 7 members. Those members' job is to oversee the provision and coordination of services provided to people with developmental disabilities in our communities. County boards were established in law 46 years ago and are independent local government subdivisions. The law requires county boards to provide service and support administration to people with developmental disabilities using a mix of local, state, and federal funds. We accomplish this task by employing support and service administrators who are similar to caseworkers, sort of common use of the term. These skilled professionals assess each individual's unique needs and develop an individual service plan. When a person is enrolled on a home and community-based waiver, the county board is responsible for the administration of the waiver and coordination of services that the individual receives. County boards of DD administer the services of more than 90,000 children and adults in the state, 32,000 of which are on waivers. In addition to service and support administration, county boards of DD provide a variety of direct services. We provide early intervention in home and facility-based settings to families of children from birth to age 3 with developmental delays. Many of our boards run integrated preschools where children with developmental delays are served alongside their typically developing peers. Some of our boards operate schools for children with special needs from age 6 to age 21. Often these school-age services are provided in partnership with local school districts. In addition to the services our boards provide to children, we also provide a variety of daily living and vocational services to adults, including employment training, job placement for people who work in their community, who want to work in their communities. We operate employment workshops in some of our facilities where the people we serve are offered a chance to work in a sheltered setting with their peers. Just like other human service systems in the state of Ohio, county boards continue to feel the impact of the nation's recession. In many communities, as you know, decreasing property taxes, decreasing property values have eroded local tax base that the DD boards must rely on for general operating revenues. The state budget shortfalls stemming from the Great Recession also had a serious negative impact on the county boards, as reductions in general revenue funding appropriations were reduced. Our general revenue fund appropriations were reduced by more than 26% over the biennium, a loss of $26 million in 2012 and $23 million in 2013 when compared to 2011. In order to cope with these reductions, the board made hard choices while working diligently to increase the efficiency of our programs and services. Over the past few years, our county boards have been recognized by Governor Kasich for creative and innovative efforts that we have employed to share services and increase administrative efficiencies. These collaborative efforts have helped us enhance the quality of our programs as well as decrease the cost, some of their costs. In contrast to the last state budget, House Bill 59, the proposed budget this year, holds the level of funding flat. Also, in contrast to the state budget last time, the state's economy has improved a little bit. Unfortunately, that's kind of a double-edged sword for us because the improving economy triggers an automatic reduction in the federal Medicaid assistance program percentage rate. That's the federal match. Over this next biennium, the FMAP rate will decrease by more than half a percentage point, and this will result in a loss of $9 million in federal reimbursements to county boards over the next 2 years. As a member of a board, I have to tell you, it's been kind of distressing. As I said, I've been on the board for some time. It's been kind of distressing to year after year sort of watch the funding for the programs that we try to provide become more and more scarce. And as a brother-in-law, I've seen Rebecca's life sort of change a little bit and her opportunities begin to decline somewhat by these year after year sort of tough, hard decisions we've had to make. As to the specifics of the budget, the proposed state budget has encouraging news for the folks with developmental disabilities. House Bill 59 includes the new Employment First line item, which has been funded at $1 million per year. These funds are intended to help people with developmental disabilities obtain competitive employment in their communities. We support the inclusion of the line item, and we respectfully request that the General Assembly consider increasing the line item significantly. Many Ohio counties are in need of strategic investments in their supportive employment programs. Some counties need more resources to hire job developers, job coaches that are essential to accomplishing the goal of a more integrated setting for people with developmental disabilities in our workforce. I'd like to commend the Governor and Director John Martin for their commitment to increasing community employment for opportunities for Ohioans with developmental disabilities. It's important to note that they do this in part by creating a presumption that people with developmental disabilities can work in their communities. And this commitment represents a fundamental change in the way that we view community integration. We support Governor Kasich's proposal to expand Medicaid, the Medicaid eligibility threshold. We believe that by giving more access to families and children who have developmental delays, the expansion will increase the chances that more children with disabilities will receive early intervention services. Research shows that early intervention services significantly decrease the severity of a person's, they can significantly decrease the severity of a person's disability in adulthood and sometimes even eliminate the disability entirely. In addition to improving the quality of life for these children and their families, early intervention results in substantial savings in future costs in the DD system. I also believe that the Medicaid expansion decreases the overall pressure, the overall economic pressure on the entire system, and will give us more flexibility and more ability to kind of evolve our programs. It's not in my written testimony, but I will say, since it came up, that we support the increase in the rate of pay for the direct support staff in the ICF and the provider organizations. The stability is very important in the life of somebody like Rebecca, and a constant turnover of professionals in her home and in her living environment increase the need for the developmental disability system to monitor and intervene in those behaviors. So a more stable and well-compensated direct care staff is important to us. In conclusion, we look forward to continuing our long-standing partnership with the General Assembly and the state of Ohio in support of people with developmental disabilities. And I'd like to thank you for the opportunity to testify for you today.